For decades, we've been treating bladder cancer as if it is just one disease, although clinically we've seen evidence that it really isn't one disease. There's patients who respond to some chemotherapy regimens, others respond to other types of treatments, including different mutational inhibitors like FGF receptor 3 inhibitors. The problem was, historically, we've never had a way of trying to break down the bladder cancer patients into their basic subgroups. More recently, we found data suggesting that there are at least 3 intrinsic subtypes of bladder cancer. We've currently defined them as basal, luminal, and P53-like. Each of these subtypes have different characteristics associated with them. The basal subtype seems to be the subtype that is most chemosensitive, and it likely reflects association with stem cells and very high proliferative rate. The luminal tumors, however, seem to have more papillary histology. We see more mutations such as ERB2, FGF receptor 3 mutations associated with this subtype, and it is a little less chemosensitive, although it does still have some chemosensitivity. The third main subtype we've defined as P53-like, which is often associated with stromal factors and different types of factors that might be more attractive to the bone marrow. When we looked at the subtypes in the patients on our neoadjuvant trial, we found that while historically the basal subtype had the worst prognosis, once patients receive aggressive cisplatin-based chemotherapy, they now have the best prognosis, moving this biomarker to something which might predict for activity from chemotherapy. Likewise, the P53-like group, which was enriched for stromal factors, we saw exclusive appearance of patients with bone metastases, again indicating this might be a tumor stromal niche that these tumor cells are attracted to. So I think in the future, as we develop clinical trials, we can no longer think of bladder cancer as just one disease. We need to start breaking them down into their intrinsic subtypes and gain an understanding of their impact with chemotherapy, angiogenesis inhibitors, FGF receptor inhibitors, and develop targeted therapies for each specific subtype.